A bill in Wisconsin would alleviate the rising cost of insulin for diabetics.
The bill would cap the cost of copays for that drug at $100 a month and find other ways to address the increasing cost. News 8's Mel Meyer explains in our top story why there is a renewed push for the bill.
Mike and Martha, this bill was first introduced and co-sponsored back in early August by a number of Democratic state senators and representatives. And now that Wisconsin Governor Tony Evers created a task force dedicated to reducing prescription drug prices, there is hope that this bill can get passed with this renewed attention. Gabby Krueger was 13 years old when she was first diagnosed with type 1 diabetes.
I have had to take insulin injections. And I was later put on an insulin pump.
The pump has a sensor to deliver the right amount of insulin, but she still has to check her blood sugar levels before she eats. In all, she spends about $85 a month on pump supplies and insulin.
I did recently have some kind of a drawback where insurance didn't cover it, and my pump supplies was $700 that I had to pay out of pocket.
Lately, she's been concerned about how to pay for her daily medication. When she turns 26, she will no longer be on her family's insurance.
I can't live without this drug. This is a life-saving medication for me.
Senate Bill 340 would cap the copays for insulin at $100 per month. It would also direct the Office of the Commissioner of Insurance to investigate and report on the pricing of the drug to see what else can be done to address the issue.
30 million people in the United States are diagnosed with diabetes. In Wisconsin, it's over 500,000.
The governor's task force on reducing prescription drug prices met for the first time Wednesday. The group will try to find ways to reduce the financial burden from prescriptions.
This is something that I hope that the committee will also take a look at and see what action can be taken.
While the legislature has adjourned for the year, State Senator Shilling hopes that people will share their stories with their legislators during listening sessions to get the bill passed.
Certainly hoping that we will have some bipartisan support moving forward.
So far, no Republicans have signed on to this bill. Senator Shilling said she has not seen any alternatives from Republican lawmakers, but would be willing to hear their ideas. Martha?
All right, thanks so much, Mal. And in Minnesota, Republican lawmakers there introduced a plan to provide free insulin to residents living in poverty who meet certain requirements. Lawmakers with the DFL party have also proposed an emergency assistance program to help those who just can't afford it.